Birth tourism cost in Canada. Do you aspire to secure the future of your newborn with the citizenship of a beautiful and prosperous country like Canada? Do you want to gift your newborn something as exceptional as a Canadian citizenship? Before you raise your eyebrows in disbelief, let us confirm that it is possible and fully permissible by Canada immigration laws. What the law says about giving birth in Canada by non-residents. The right of giving birth in Canada for non-residents is protected and honored by the government with the assurance of Canadian citizenship for the newborn baby. Let us see what the Canada immigration law says in this respect. As per the 3(1)(a) of the Canadian Citizenship Act, any person born in Canada is automatically designated as a Canadian citizen. This right is further upheld by applying the regulation to all newborns irrespective of the citizenship status of the parents. This directly implies that the non-Canadian parents can give birth to their child in Canada to secure Canadian citizenship right for the newborn. Giving birth in Canada for permanent resident is further legally protected by the Immigration and Refugee Protection Act, IRPA. According to this regulation, giving birth in any healthcare facility in Canada does not amount to a violation of the terms or conditions required to be fulfilled by international patients. How much does it cost to have a baby in Canada with or without insurance? The Canadian healthcare system is a publicly funded Medicare system. Citizens and permanent residents of the country have free access to this system. For them, the cost of giving birth to a child is either completely free or equals to the cost of a couple of $100s to pay for a private ward. Tourists and non-residents have to pay bills from their own pockets if they do not have international health care insurance to cover the costs. The cost of having a child in Canada without insurance or access to the Canadian Medicare system is indicated in the table below. Average costs without insurance CAD. Antepartum care, 1 visit, $100 to $150. Prenatal fetal screening, $300 to $500. Vaginal delivery at a hospital, $5,000 to $8,000. Cesarean section at a hospital, $10,000 to $12,000. Home delivery with a midwife, $2,500. For instance, in British Columbia, where baby tourism is particularly developed, there are agents providing a package of services for pregnant women. It includes midwife services, 3-month accommodation, including a month after birth, but excludes food and prenatal care. The costs are about 25,000 Canadian dollars, or approximately $18,000. With the round-trip flight, food, and other expenses, the total amount will be higher. In other provinces, for example, in Quebec, the costs may be lower. How much does it cost in the U.S.? In the U.S., prices vary from city to city. In New York City and Los Angeles, the delivery services are above $20,000, $7,000, $10,000 in Miami, and $5,000, $6,000 in Salt Lake City. The costs in Salt Lake City surge to about $18,000, $22,000 including flights, meals, accommodation for 2 to 3 months for 2 adults and a newborn. Therefore, prices in Canada and the United States are not very different. Giving birth in one of these countries costs $20,000 on average. Canada versus the US, where it is better. The healthcare system in Canada is one of the best in the world and can easily compete with the American one. Canadian citizenship is not worse than American, and the standard of living in Canada in many aspects, safety, access to education, etc., is higher than that of the US. However, most baby tourists travel to the United States because this industry is functioning on a massive scale there, and many suppliers offer packages that include all the necessary services. In Canada, this business is almost undeveloped. At the same time, birth tourism levels in Canada are 5 times higher than it is stated by the official statistics.